I am interviewing Tracy McTurnan,
And
Traceyer.
it's C-E-Y, but that doesn't matter.
Tracey.
Yeah, M-C, capital T-E-R-N-A-N.
She is still continuing to struggle with chronic Lyme disease or post-treatment Lyme disease, and seems to have a renewed bite that they are currently treating.
Yeah, I'm on doxycycline yet again.
How do you take it?
It's right here. It is oral, 2 pills a day. And I apologize for not being able to speak well. That's part of Lyme disease.
Wow, she's on doxycycline mono 100 milligram tablet. Take 1 tablet by mouth twice a day. And how many days are you taking it for?
This is another round of 30, so I've been on it for
15,
it'll be 60 days.
2 days?
60 days total.
You're taking it for 2 months straight?
Yeah.
So how did you first discover that you had Lyme disease? When was it? How did you discover it?
The first time was probably 5 years ago. 5 years ago, I went to my normal OBGYN appointment, and she realized I had been running a temperature, and she got a feeling that something was wrong. So she referred me to my family practitioner for a checkup. And my family practitioner ran the usual blood work that you would have with a physical. And including in this area, Lyme disease check is always a thing. So
it's part of a routine annual checkup?
It was, yeah, now it is. At my doctor for this area, it is. I don't think it is everywhere. So it came back positive. And I ran 60 days of doxycycline then, and I felt great.
How were you feeling when you went into the OBGYN?
I had been feeling, I don't want to use the word, I was really tired. And I didn't know. I was just used to not feeling well.
So it wasn't really that out of the ordinary.
Yeah.
You're just like, I'm just fatigued.
Yeah.
I just need more sleep, but I go to my annual exam.
I go through, do what you have to do. And she picked up on it, but something was up. So she referred me to Dulcie, and Dulcie found Lyme disease and treated it. And after she treated it, I felt great.
And she treated it with 60 days of doxycycline 2 times daily?
And I felt great. I was able to exercise. I could think clearly. I lost 70 pounds in a year.
Without dieting?
No, I was able to think clearly, eat really well, exercise every day, and I lost 4 pounds a month. Healthy amounts, and I lost 70 pounds. And then a year and a half, I'm feeling great. I started to feel bad again. Around the time my granddaughter was born, I started feeling bad again. And I didn't go to the doctor. It was completely different than the last time I had Lyme disease. The last time I had a headache and the fever. This time I had no headache, no fever. I just felt bad and my body was hurting. But I let it go like a year and a half till finally I came in the kitchen and I told to my 2 mics, I said, there's something wrong with me. I got to go to the doctor. I could barely make it up the stairs. And so I went and she found Lyme disease again.
To your nurse practitioner?
Yeah.
She ran another blood test.
I mean, they checked me for everything because I have like symptoms of thyroid, so they checked me for everything. So it came back positive, Lyme again, and she treated me. I think it was on it 90 or 120 days of this doxycycline, and I just kept getting worse. I couldn't walk. I couldn't see out of my right eye. Totally couldn't hardly hold a conversation with anybody. Then I wasn't getting any better, and Dulcie referred me to some Lyme specialist and kind of just like pushed me away. Meanwhile, my husband sees Dr. Foster, who is another doctor in that practice, an elder, a true doctor, not a nurse practitioner, but a doctor. And so I went to see him. And he says, well, let's get off the doxy because that's not doing anything. And he had me go into the hospital once a day for an infusion of a really stronger antibiotic. And all symptoms went away except for the tiredness. I just can't kick it. And the fog. And I was just tired.
Were your joints? Why couldn't you walk up the stairs?
My knee, it attacked every joint. Knee, ankle, shoulder. This past end of January, it got in my neck. I was in excruciating, I think I texted you, I was in this excruciating pain where I was like screaming pain. And I'm not.
No, you didn't text me.
I couldn't move my neck. And it's settled in there now. I can move it again, but it's still not right. So it was time for my annual again. So I go back to the doctor, and he runs his normal things they do at a annual. And included with that was Lyme disease. And I said, "Are you sure? I'm a chronic or a post-treatment Lyme case. Are you sure?" He says no, because it came back positive, and then they run a second test, which is called the Western blot, where they really break it down as to what's going on in your...
The Western blot is another blood test?
Yeah. Your doctor will get a positive, and he'll refer it on and say, test it again using the Western blot. So all these numbers were sky high again. And I'm like...
Sky high for the virus?
Yeah.
So the antibiotic was not killing off the virus, you were getting reinfected.
He said I got reinfected.
How many times is this reinfected now?
I think I've
3
had
times?
3. I think now that I know what it feels like, I think I had it when I was carrying Michael. Now that I know what it feels like. And so yeah, he says reinfected again. So now I'm on this again for 60 days. I don't have other symptoms other than tired, fog, and the neck is what I'm dealing with right now. But like some of the times that I had the Lyme, it got into my joints about I couldn't snap. So I got my snappers back. But different things like that. And the eye, like losing your vision in one eye was totally blurry. And everybody is different. If you talk to different people, everybody will say, I had this or this symptom. Some people say it brings out whatever you were predisposed to
It's
have.
attacking your vulnerabilities.
Yeah, like some people have serious arthritis problems. Some people might have kidney or, your family genetic. It could pull out those things that are individual. So,
So a timeline, just from the first diagnosis.
5
Michael's
years.
12 years old, so you believe you had it undiagnosed when Michael was a baby.
Yeah.
That's the first time you felt these sort of symptoms. And did they just go away?
Most of it.
But you've carried that with you for 12 years.
Yeah. I think I was well 2 out of 10 years.
And what did it feel like in the years pre-diagnosis between Michael's birth and your diagnosis?
Super tired. I gradually got better because when I had Michael, everything hurt. I was in this fog. I was at the end of my student teaching. I don't know how I got through it. I was very pregnant, and I just got home from school, and I just you want to sleep all the time. I have 5 good hours a day now. It makes me very sad. He asked me if I have depression. I said, I don't think I have depression, but I am depressed about my quality of life. It's hard. Because when I'm well, I am a force. I do amazing things, and it really bumps me out. I'm sorry, I'm getting sick.
Did it play into your decision not to go further into teaching?
I don't know that I could. I mean, I subbed for 6 years on days that I was okay, but it was a struggle.
But you didn't feel like you could then pursue a full-time teaching gig because...
Yeah. Just could hardly think. Everything is a big deal,
So you'd get a subbing call in the morning and you'd say no if you were feeling bad, or yes if you happened to be feeling good?
I would go because I was trying to get a job, but you don't sleep either when you have Lyme.
Why not?
I don't know, but that's a big thing of Lyme people.
That you find that's common among the people you've spoken to. None of them sleep.
I have a daughter who had it for 3 years. Sometimes I think this is my karma for not understanding. Megan had it from 13 to about 16. And she was awake all night, and she went through the antibiotics, and it didn't kick it for her. And I used to force her to go to school. I just wanted her to go to school. She had to go to school. And she would look at me and say, "You don't understand, Mom." So I think sometimes it's that. But I don't think so. I don't know. This coincidence.
Well, it's not coincidence. We live in the epicenter of Lyme disease.
We do.
And you live right next to a river in a huge house. You love to garden.
Yeah.
You have dogs and cats who go inside and outside at will.
Yeah.
That puts you at like extreme risk.
Yeah. So my daughter.
I don't think you could have a more risky lifestyle.
Yeah. For Lyme. I know. Yeah.
Like an otherwise healthy lifestyle. That's the thing. That
Yeah.
Lyme disease is like the healthier lifestyle you have, the
more
more you're at risk for Lyme disease.
Yeah.
So between when the birth of
my
third child and your actual diagnosis of Lyme, there was how many years?
Let me see. That was 5 years
9?
ago. 5 years ago, and he's 12, so that was 7.
So 7 years when it was just malaise, foggy. Were you foggy?
Yeah.
So just really tired, couldn't sleep.
Yeah.
Really?
Yeah, no sleep. Back really hurt.
So that would
Body
be
aches.
joint probably.
Yeah.
Okay, so foggy, trouble sleeping, achy joints, this time in your spine.
And I didn't think it was that because I had an epidural. I never had an epidural before, so I thought maybe it was a residual from an epidural.
And was Lyme really talked about back then?
It was a thing for me because I had survived my daughter having it.
Oh, okay.
So it was a possibility,
Okay.
but I didn't see it.
And but you have waited to your annual exams. Why do you think your OBG never said there's something wrong? Let's get you, because you weren't running a fever.
Running the fever was the red flag.
You didn't have fever.
And I had run a fever, I guess, for months.
Okay, so then 6 years after gosh, my quality of life is going away. I don't know why, but I'm not the person I used to be.
I think like when I had it with him, I think eventually you kick it.
You can, yeah. Your immune system can topple it.
Eventually, you kick it.
Yeah.
Just like with this post-treatment, they say eventually it'll go away. Oh, my neck. They say eventually it'll go away. But
somewhere in that 6 year period, you actually felt back to normal.
Not back to normal.
No, never back to normal.
Yeah. I just thought it was part of having a child so late in life, and
maybe having an epidural.
And I put on weight, so I thought that was part of it. I don't know. I never thought it was a thing for me.
So then, 6 years later, you go into your OBG and you have got a fever. She starts running the tests. You take the 30 days of doxycycline?
I think I had 60 that time.
Okay. And
I got better.
You got better?
Yeah.
Like you thought it healed you?
Yeah. I felt like I hadn't felt in so long. It was incredible. And then a year and a half went by, and I started feeling the energy started to drain. The fog came back. I was tired. But I dealt with it for a year and a half because it was different than the last time. And I don't know. For some reason, I thought, how can I get this again? I'm like, after you have it a couple times, you're so careful.
Yeah.
I'm so careful. My pets are on the stuff, and I dress like a crazy person to garden. I'm all wrapped up, So I didn't think I had it. So I waited a year and a half, and I think that's when you get chronic or post-treatment Lyme, is when you wait too long.
It's a high-risk thing.
Yeah.
It definitely leads to complications.
Yeah. It makes it very hard to kick.
So you waited, after initial symptoms, you waited a year and a half. Then how was it discovered?
Again, a yearly exam.
With the OBG?
No, with my
your
regular primary girl. And she says, you got Lyme again.
This time, did she treat it with a doxycycline?
Yeah, that's the protocol.
But this is the second diagnosis.
Every time you go through a round of this.
Got it. So then the second, so you took it, and how did you feel? Did it wipe all the symptoms away?
No, got a little better. but still very tired and very foggy.
Is that when you went to another doctor?
That's when, yeah.
And then you start taking intravenous.
Yeah.
That was how long ago?
That was last fall.
Last fall,
Like,
6 months ago? Last fall?
August, September, a year ago. About a year ago. I was...
Right before we met.
Yeah.
I had heard.
Yeah.
When I first met him, he said, my mom has Lyme disease, and then suddenly you were better.
Yeah,
so
but
after
Mike
the
said I was
intravenous...
better. Mike wanted me to be better, so he was saying I was better, but I struggled the whole time, you know?
Okay. But that was... So when I met you, you had just finished intravenous Lyme.
For a month, yeah.
You had been done for a month, and you felt...
Like
on a scale of 1 to 10, like if 10 is your normal self. 10. The self you love. The stuff that gets stuff done.
Maybe a 4 or 5.
So health for you is now a 4 or 5 of...
What it could be.
Wow.
I usually have... my me has a lot of energy.
Wow.
And does incredible things. I was working on Domestic Goddess. Cooking everything and, doing everything there. Creativity level was super high. And
so when I met you, you were about a 4.
4 or 5, yeah.
4 or 5. And did you stay at a 4 or 5 until this must be a couple weeks ago.
This is the second month.
So a month ago, when did the third route?
Maybe 3 or 4 months ago, I started with a headache. And I always think that for some reason I don't go to its Lyme again because I've been so careful.
Right.
So when he tells me that I got it again, I'm like, how? I never get a bite.
These ticks hate me.
Right. I never get a bite. I hadn't pulled one off my body.
You never saw... Did you ever see the bullseye?
Never. I never did on my daughter. Never did on my daughter either.
Any other raised...
No.
Red?
My first diagnosis, the one that fixed me and I felt great, I had a rash here and here. And I couldn't see it.
Right.
But I could feel it. There was a rash.
A raised, it was probably
at the
red.
base of my neck and at the bottom of my spine, there was a bumpy patch.
Was it red?
I don't know.
Okay.
I don't know. And I never went to Mike and said, "What is this?"
Yeah.
We were in the pool and he says, "You got one hell of a zit on the back of your neck." And I said, "I don't think it was. I don't think it's it. I think it was some kind of bug bite." And then not long after that, my doctor found it. So that one, I probably had something.
So when you trace the whole journey to now, when the 6 years post-birth, this rating from a 10 to 1 is very insightful to me. What would you rate it as when you were like, maybe it's just the epidural, maybe it's just being tired because I'm a mom?
It was like a 5.
A 5.
Yeah.
Was there a moment after the intravenous? Was there a moment when you popped back up to